Further member statements. The member from Scarborough-Agincourt.
Thank you, Mr. Speaker. I rise today to recognize the Community Health and Wellbeing Week from October the 16th to the 20th. The theme for this week is Health Equality at the Centre. During this week, we have an opportunity to reach out to the people who face barriers to achieving the best possible health and well-being. We recognize that not all Ontarians have equitable access to health services. Indigenous people, Franco-Ontarians, newcomers, and people with mental health and addictions challenges often struggle to get health care they need. Through the Patients First Act, the government demonstrates their commitment to improving health access and equality, as well as reducing health disparity. The passing of this legislation, Mr. Speaker, empowered the LHINs to be responsible for building a more sustainable, efficient, and accessible health care system. Speaker, I want to recognize Scarborough-Agincourt Home Folk Nurse Practitioner-led clinic for putting health equality at the centre by addressing barriers to well-being such as racism, sexism, and homophobia. The clinic staff offer a variety of primary health care, mental health services, outreach program for people facing homelessness, and impactful education mentorship programs for at-risk youth in Toronto and York region. During this week, Mr. Speaker, Ontario's 107 community-governed primary health care organizations will host events to showcase their work in serving the people most at risk for poor health. And I encourage all my colleagues and Ontarians to visit these organizations throughout this week. And I look forward to visiting Home Folk Nurse Practitioner-led clinic later this week. Thank you, Mr. Speaker.